Okay. Yeah. All right. This is the Aspirational Healthcare Advisors Group. And Jeff, I'm going to let you introduce Dr. Paula Muto from UBERDOC.
Thank you. Thank you, Daryl. And I'm here in Miami with my daughter, who has arranged for us to be on a little cruise around the Miami Harbor. So it's a little bit distracting. I didn't know I was going to be sitting in this setting at this time, but I started working with Paula. I saw her. Something came up, and I called her one morning, and we've been sort of talking back and forth ever since. And I immediately, upon having that initial conversation, and I've kind of felt this all along about healthcare, is that the technology is really not all that important. It was right to the right over there. It's more the people that are leading. People like Vidar and all and Daryl, you, all the people that are on this call. If you can get these visions working together, the technology is going to follow. And I fell in love with Paula's technology because it's very simple, and it really can serve as a lightning rod to help employers and advisors appreciate how, well, particularly the advisors who are really so much in charge of what happens in the healthcare space. If they can help their employers appreciate how important it is for their health plan to support and accommodate open networks of doctors, then all of a sudden the physicians have the conditions that they need to support what the employers want out of their health plan. And Paula's system is set up to help establish that vision and put brokers in a position to carry that message. And so I'm just real pleased that she's taken the time to come and visit with our group. And I've got a number of things that have been put together within the framework that I've set up called Concentric DNA to attract, actually have a cash-centric platform that's very attractive and can be very easily understood. And I think it can easily be set up so that the incentive for the brokerage community can be far greater than what they have now, that tends to keep them, it makes it very hard for them to leave the BUCA contracts that are out there. So with that being said, I'll turn it back over to Paula, and I look forward to just a lot of open conversation about what you guys think about what UBERDOC's doing. Thank you.
Great. Thank you, Jeff. I appreciate that. I'm going to just share my screen. Is that okay?
Sure.
Yes, please do.
I have my screen there. You guys see my screen now, and let's see, where's my slideshow? So it's interesting when I got the request to talk, I said, what am I going to talk about? I've been giving these high-level conversations and talks about healthcare and finance and all the market forces, but you guys all know that. So I'm going to really just talk about like what birthed UBERDOC, like because I'm coming from the doctor side, right? I'm coming from the doctor side, why we built this and what it does. So that's kind of what I'm going to focus in. So I'm a surgeon, in practice, from a vascular surgeon, from a family of surgeons. My dad was a surgeon, my husband's a surgeon, my brother, 2 uncles, all in Massachusetts for a collective century. So it's kind of the family business. I always ran my own practice in Massachusetts on the front lines between 2 hospitals. One was nonprofit, one became for-profit around Massachusetts. If you're at all familiar with, now it's Mass General Brigham, it was Partners, creating sort of a monopoly in the state, and then Steward Medical and all the other players that came to the table. So we've kind of been living through pre-Romney care, Obamacare. So from a frontline perspective. So this is where it all came from. And it's very simple person said, I think it doesn't work. I think patients can't get an appointment with me. Very simple. Can we make that easy? A patient needs a doctor. Could they get in without a phone call? Could they get in without a referral? And could we make that price a little affordable, like a little lower than what commercial insurance is paying, but a little higher than Medicare to be legal? And that's where UBERDOC came from. So we created what I like to say is a walk-in model for specialty care. So we know our healthcare system is flawed. You know, there's bad debt, high administrative costs, struggle with staffing. And this is a real issue, especially after, and I should say hospital as well as office challenges. And these challenges have just spilled directly onto the premiums, directly onto the patients, because it's just so hard with all the confusion. You can't train and retain your front end. And now after COVID, you can't even find anybody who wants to work in a cubicle with no ventilation for $10 an hour. The patients, though, this is the issue. 70% are unsatisfied. The recent Harris poll said 70% unsatisfied. 70% wanted a better relationship with their doctor, actually. You know, 85% of patients trust doctors and nurses. You know, I think it's fewer than 10% trust insurance companies or the government, to just kind of put it out there. There's absolutely long wait times. There's no transparency. It's inconvenient. It's inaccessible. No one questions quality. Quality is never questioned because we train a long time. Doctors have the trust of the patients. You don't choose your pilot, you choose your airline, you know, and I think patients very much behave that way. The other thing that's occurred is the shift toward people having deductibles. When we started this so many years ago, deductibles were just coming into the marketplace. Now the deductibles pretty much exceed the cost of care. So everyone's paying out of pocket. So we decided to create direct-to-consumer healthcare. Let's find a doctor nearby, available, push a button and make an appointment. Wait, say that again. Nearby, available, push a button, make an appointment. That's how easy it is. So how can we do that? Well, we take apart referral, we take apart authorization, we take apart the phone call technology, and we set a transparent price. So it's literally best specialists that are nearby, available, and a single price. So it's 1, 2, 3 for the patient, like literally that easy. You find a doctor who's nearby and available. Dr. 3 Mile beats Dr. 5 Mile. Doctor like Tuesday beats Dr. Wednesday. And literally it's that simple. And all of our doctors are vetted, board certified specialists in practice with license in the state that they have their licenses. You know, with telemedicine, the word nearby became not just the doctor 3 miles away, but perhaps a doctor who's licensed in your state. So that's kind of the exciting piece. For the doctor, it's even easier. It's literally one step. The doctor just says thumbs up. Like, what? Thumbs up. You have to understand who these doctors are. They're not old doctors like me who has an office that says hello to you. No, these are young doctors who are very tech savvy, who would get this on their phone and they're literally saying yes to you faster than their secretary can at the front desk. We are matching technology with people. Patients just say what they want. It's as easy as that. Doctors have their own landing pages. They have an infinite availability. We use the word Uber to say, and we're not part of Uber, we're trademarked, where Uber means above. It means universal. It means better. We started because we're specialists. What do we mean by specialists? We don't have mid-levels. You're not getting a nurse practitioner. You're not getting a mid-level. You're getting a physician specializing in neurosurgery, endocrinology, family practice, pediatrics. Remember, all doctors are specialists. So an internal medicine doctor that sits on our platform that does in primary care is in fact a specialist. Sure. And we make that distinction because so much of our healthcare system is built on that front end, you know, go to the walk-in and get sort of a mid-level care, which is not definitive care. When you go to an UBERDOC, you're going to get an answer. And that answer is hopefully going to be close to what the answer should be because we're specialists. So we schedule, bill, collect, send an email, all without a phone call. It's like, oh my gosh, they just had a thing about doctors spend 30% of their overhead just to do this. Doctors spend 0 to do it with us. 0. It's like we've made it very attractive to doctors. Why? I get doctors' DNA. So basically, in doctors that belong to big systems, this is like a great visual. It's like these are all the people that come into your examining room. And I'm going to say even one of my patients recently said, somebody knocked on her door. She's a Medicare Advantage patient. Somebody knocked on her door and wanted to come in to take her urine. It was not a nurse. It was not a doctor. It wasn't even a medical assistant. It was a representative from probably United Healthcare, her Medicare Advantage program. She said, someone wanted to take my urine. I refuse to give it. I only give my urine to my doctor. But can you imagine the intrusion right? The absolute intrusion that you're keeping patients at home so that they don't go to the doctor, they don't utilize, so that they can capture that spread, right? They can capture whatever it is that they're going to be rewarded if they don't spend on the patient. Really awful incentive, but guess what? The patients figure it out fast. And people forget about that. The patients figure it out fast. So of course, I always told her, well, honey, if you ever have any chest pain, you go right to that emergency room. Shh, I didn't say that. But anyways, so UBERDOC is meant to increase revenue, not by billions, but by enough to keep a doctor's practice going. We look about independent practitioners. We look at groups of doctors who really have a hard time with that overhead, because we're the, I heard Tom Price speak the other day, and he pulls out a piece of paper. And Tom Price used to be the head of Health and Human Services. Remember, then they said his airplane was bad, but it was really because he was the first doctor ever to head the largest healthcare organization in the country. HHS has 80,000 employees, more than any other. Takes up more of the budget, and was the first physician. And he puts up a graph and he said, see this line at the bottom? These are doctor payments. They haven't gone up. This is the line at the top. This is, let's go into administration. So physician payments have only gone down. And with inflation, they've gone down even further. So we're in a bit of a pickle right now, and doctors have been dropping out. Have you noticed? 115,000 physicians retired this year. Retired. That's like close to 15% of our workforce. They just unionized. The residents in Boston just unionized at Mass General Brigham. They just voted to unionize. So you have sort of market forces happening here on the physician side that are very, very interesting, because there's no survivability with the debt that people are in, with the payments that we get, and with the margins that are just terrible because all the costs have gone up. So UBERDOC is just meant to offset a little bit of that, right? A couple of patients a week can pay your front end. If you're a group of 5, it could pay your nurse practitioner. If you're a group of 10, it could pay the salary of your new doctor. So we basically improve that payment, improve liquidity. Now, the downstream revenue from direct pay patient is really important for physicians. And this is when, healthcare advisors go, oh my God, utilization going up. It's like, time out, calm down. These patients need to see doctors. They have a hernia, they have a hernia. They don't need to go to 5 stops before they get that hernia figured out and fixed. That's the great fiction with all of this. There's this great fear that if you get to a specialist, you're going to have all sorts of things. I'll give you a little secret. Doctors only add tests or add visits if they don't get paid. It's just a pure reaction of like, I'm going to get. So if I know I'm getting paid for this, guess what? You don't add to the bill. And we've seen this in UBERDOC patients who go to orthopedics and they get that x-ray, for example, because it doesn't cost them anything. It costs them more to bill the x-ray than to do the x-ray. And they just want to move the patient along. Trust me, I get doctors. That is what we think of. We are not motivated by money. We're motivated by volume, right? How many patients are in my waiting room? I get 5 gallbladders instead of 4. I get to take care of 3 carotids instead of 2. This is how doctors value themselves. So the concept here, and there's only less than 1 million of us. So we can't really waste money and waste time. There's only so much operations we can do in a day. So that's what is sort of like the business model behind it. We also reduce the cost for the doctor. That's a big thing. And we reduce the cost for the health plan and for the patient. We supplement urgent care. We are not an emergency system. We have a 12-hour lockout. You can't say I'm having chest pain, I'll find an UBERDOC. It doesn't work that way. And actually VDAR's company Validation Institute validated us for decreasing urgent care and ER utilization, because that's what, instead of going to the urgent care, you can cross the street and go right into the orthopedic office and get definitive treatment. And that's going to save money. So we like to think we have a competitive edge because there's nothing really quite like us out there. I mean, there's a ZocDoc, but they work through the insurance model. They have a ton of mid-levels. There's like chiropractors, and there's, then there's a massage therapists. It's a variety. UBERDOC is UBERDOC. That's it. Navy SEAL. That's what you're getting. That's what our brand is. And we like to say that we meet the community access because we are nearby and available. What frustrated me many times being 20 miles outside Boston, that a patient with like a breast lump would come and see me, easy to take care of locally, very inexpensive to take care of, but they would get referred sometimes all the way into Boston because their employer had made some kind of deal. No one paid for their parking. No one paid for the families that had to drive them all that way for their treatment. And it's for something that could be handled so beautifully in the community. They would get their radiation treatment at Mass General. One snowstorm later, and they couldn't get into town for their therapy. So there's a lot of silliness in the system. So we like to think that keep it competitive, keep the local care local. If you want to see my brother, who's a G1 oncologist, who's an expert in ovarian cancer, he has to live at an institution because there's just not enough ovarian cancer out there. But you can't, not everybody can be a specialist in that, right? So you consolidate that service in a Boston hospital, but a gallbladder, a breast lump, there's a lot out there, right? You don't need to go to these very expensive tertiary cares for all of this care. The other thing people forget about is there's a lot of like fluid traveling happening right now. Young people don't stay put. I read a statistic that 1 million people in New York City are transient, and that was before the immigration issue. People come and go. They change their employer. They change their location. They can now live in New York and work in Washington, D.C., right? There's like all sorts of things happening in the workforce since COVID that's going to remain. Office buildings and FIDI are empty because those people in those office buildings don't live in Manhattan. So their health plan in New York can't satisfy all of their needs. And of course, we have tremendous with tourism and so forth. So there's a lot of government regulations too out there, but the most important one is price transparency. And hospitals are not transparent. And you guys know this, right? Because you're in this mix, like begging for someone to tell you a price. They will never tell you, right? They will never tell you. But honestly, UBERDOC is a transparent price. That's what it is. And why is that important? Because I treat my patients in the office. I mean, very rarely do I have to take a patient to the OR for like a vascular procedure now. Yes, I have an appendix, yes, a gallbladder, but for everything else, you're doing this now. Your care is very much office-based. And many of our orthopedics now, they've left the building. You can't find a good orthopedic in your institution anymore. They have their own surgery centers that are better, faster, cheaper, following the model of like the Oklahoma Surgery Center, right? They set the bar. You can do it better, faster, cheaper. We all know. We have to sit there and watch administration come in and say, hey, you have to throw away everything. Everything became disposable. I said, but I've been using this trocar for years. You can wash it. You can put it together and it costs nothing but the washing. And you got to wash all these other instruments. Nope. They wanted me to replace it with a $120 disposable piece of equipment. Okay. When I got my hand slapped and I was put in doctor jail when I refused to use their alcohol prep with chlorhexidine for my patients, which was known to cause fires, which was known to cause irritation. I'm a wound specialist, skin specialist, so I don't want that on my patients. And they wanted me to use a $4 non-recyclable, flammable item, as opposed to betadine, which was a penny, that had been used in Haiti during the earthquake with a 0 infection rate. Okay. But this was a perverse incentive that somebody introduced in to say, if you use this device, whatever. And I went to Dr. Jail temporarily until I showed them the data. I said, excuse me, this is written. Oh, who wrote that? I said, your own hospital policy. This is just your policy from the bylaws. I'm sorry. But anyways, so now when it comes to Medicare, how does UBERDOC work? I like to think that UBERDOC gives you the advantage for only $50 because a $50 appointment hold gets you in to see an UBERDOC, and then the UBERDOC would bill Medicare as they would normally in total compliance with the 2016 regulation. Now, Medicare Advantage, they act like insurance patients, they're pure cash. But for Medicare patients, you can navigate care for an elderly patient. We think we're innovative, we're direct to consumer, and we're way in accordance with all the laws. CMS actually really likes us because we improve access for their members. This is the big issue. And this is a huge issue, and it's become bigger and bigger, is that we've talked about it before, doctors are dropping out and we're all getting older. And when you get older, you get more chronic disease. What do I mean by chronic disease? You need a cardiologist to manage your cholesterol sometimes. Maybe you need to have a stent. Maybe you need an endocrinologist because you have some thyroid issues that are not completely controlled. A good primary care, good luck finding them. My primary just left. And I'm like, you can't retire yet. Because who's going to take care of me? So you get these, you don't have anyone following primary care, right? People are coming out and they're those mid-levels and they don't know any more than you could Google, and so it's really, really hard as these aging population, there's going to be a significant demand for specialists, almost to replace some of the lack of primary care. And in other instances, just to basically take care of you. So one of the things that's really cool is that we can recruit doctors. And now I don't want to say it too loud, but Optum asks us to recruit doctors for some of their programs. They are cash programs, so we are always happy to recruit doctors for opportunities that give them cash options. But Optum has even recognized us as really good for getting doctors. And I only say that because if your employer is based in, say, Montana, and you need to recruit doctors, you tell us, we go find them for you. Doctors listen to us. Doctors open their emails. Doctors, I can convince a doctor. I pretty much twist their arm within less than a minute. They're on my platform. I shame them into it. So we like to think on the patient side is what we're all about, right? We're just democratizing access to care. You don't have to have the right job, the right employer, the right amount of money, the right connection. You know, that's horrible, right? Everyone should have equal access to the best because doctors look at you like a body part. Okay. I don't really care about your insurance. I care about your, like, wow, that's a cool case that's coming my way, right? In the right now, insurance puts obstacles in, right? Oh my gosh, I can't take care of you. I lost a patient and I haven't gotten over it with an Obamacare patient in Massachusetts that I had to fight to get her breast MRI with her known cancer. We couldn't get it diagnosed because it was so painful for her to get the biopsy. I had to fight for the approval. I had to fight, and the day before she got her chemotherapy, the day before, she calls me in hysterics saying insurance, they canceled her first dose of chemo because insurance hadn't approved it yet. And it's like, I called the oncologist and he's like, my hands are tied. And guess what? This is Dana-Farber. This is the number one, right? The one that owns all of Massachusetts. And my brother, who is an oncologist, told me just 3 days ago, Dana-Farber doesn't have any chemotherapy. There's no supply of carboplatin happening. His rich patients are now traveling to Europe to get their chemotherapy, and his poor patients are getting lower doses. This is Dana-Farber, okay? The Jimmy Fund, all right? The richest country on earth, and we aren't even able to treat. My brother's retiring in 6 months, he's done, right? This is why we're losing doctors. So I like to think UBERDOC is a nice way for doctors. And I think the reason they join is because, yes, they want to do a good deed. They want to become accessible, affordable. We do so much in our offices. Screw the system. We can take care of you. That's basically what my doctors are saying. We have telemedicine. We had it before COVID, I want to say, because the inventor of telemedicine, who invented telemedicine for video conferencing for the space station, came to me and said, "You're beautiful." I said, "Well, I know I'm beautiful, but why am I beautiful?" He said, "Milton said, because you are bringing access. I want your model's the model." He saw it along. He said, "I want telemedicine in the hands of an end user." I said, "But Milton, I'm a vascular surgeon. What am I going to do with telemedicine? I use it all the time for my vein patients." And now everyone uses it. So long before COVID, we had it. He saw the future, right? Because he's the technology guy. Now with telemedicine, you're in Alaska, you can get like eyes on somebody. But better than that is maybe there's a person in Alaska with a gynecologic problem that's sitting in front of a gynecologist or a primary care that needs my brother's opinion, right? You can't do that now without paying $1 billion, but you can with UBERDOC. And that is the most exciting part of it. We piloted internationally with India to be able to bring point of care consultation in and not worry about the payment, right? Just pay it, do it through UBERDOC, it gets paid. Nobody doesn't get paid. And it's just the way this was meant to happen. So we have doctors all over the country. We are, again, the biggest. We actually have close to 5,000 now. This is an old slide. We have 57 specialties because we just put on palliative care, which is fabulous. We have tons of appointment availabilities. We want to sell them. We need you guys going out there and tell everybody UBERDOC, 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 because this is how it's going to happen. About close to 2,000 patients actually have used this platform to date, and they're all happy, I have to say. And it's not hard because the system is so cruddy. With a 70% dissatisfaction rate, we only have to really be 69% satisfied. But let me just tell you, our patients are very satisfied. The no-show rates are low. And we've had this massive increase, as you can see, in doctor sign up because doctors just like this model. They work too hard to not take care of patients. So the consumers, and this is very true for, as you pitch to your employers, this is what they ask you for, right? Transparency, satisfaction, engagement, they want choice, right? This is what everybody wants. This is what we call value-based care, right? You want to make sure that you know the price. You don't want it to be $1 million. You want to just be taken care of. And we want to be sensitive to the fact that these are people out there that are trying to, that are, like we say, we can do all these things, but it's all about implementation. At the end of the day, it's a patient and a doctor, right? It's a patient, it's a human that doesn't understand their medication. They need to call someone and know what the problem is. And our system doesn't accommodate that now. So the cost trends, you guys know all of this, everybody wants to know the price. Now everybody's paying out of pocket. And this is just true of all ages. Everyone's paying out of pocket for care. So when we think of employers in UBERDOC, we're just a bolt-on. We take it from the Team Cuban. Team Cuban, they're partners with us, Cost Plus. They're like, here, tell your employees, ask for, they can just get their prescriptions through Team Cuban, through Cost Plus, right? We're the kind of the same way. We just want you to tell your employers, tell them about UBERDOC, right? Tell them and say, hey, tell your employees, this is great. You can use it. Priority access, no restricted networks, happy employees, because employees that are gone for like their primary and they're waiting for their referral, they're not happy and they're not sitting doing their work, right? You have a lot of downtime. So we are basically cost plus. We're very much reference point pricing for these visits. And everyone says, well, what happens with the second step? What happens at the next step? Well, guess what happens the next step? It's dictated by whatever the health plan is. We cannot change that. We're not working around your health plan. We're working as the front door to get them in, and then they follow the same rules from their health plan. And the nice thing is we just added a reimbursement tool as well. So that patients can kind of like take their summary and submit it to the plan if they need to, for potential reimbursement, or just proceed in the cash model the whole way. We make it so easy. We also have these gift cards. We partnered with Spa Weeks in like 14,000 locations across the country. They do massage and therapy, herbal therapy, sort of like, wellness things. And they came to us saying, can we make a gift card with you guys? It's like, sure. So now an UBERDOC gift card can pay for your mammogram, or it could pay for your pap smear. And this is kind of a cool thing to add as employers. When you sell to employers, gift cards might be good for those employees that might not be covered by the plan, but they're valued employees, and you might want to reward them in that way. So will the new delivery models emerge, right? Of course, you're seeing this all the time. This migration away from the BUCAs and into these self-funded plans is happening. It's happening probably faster than the BUCAs thought it would happen. They're going to fight back a bit, or maybe not. Humana gave up and said, I'm just getting the government bill. A lot of people are just giving up and saying, I'm okay. Optum said, what do we care? We have doctors, we sell medications, we still have that, right? So there may be a little bit more room in this marketplace for thought process and choice. And that's all good for you guys, because that's what you're selling. But they're absolutely, these trends are here. And I think UBERDOC is such a good complement to all of what you're doing, because oftentimes it's hard to sell a service without the network. Oh my God, but we have the network. Well, don't worry about it. We got it. We got you covered. We got you covered, because I can get doctors anywhere. And because we're networkless. We're either a giant network, we're an open network, or we're the Doctors Without Borders. So we're really also, remember this. This is so important for what you guys do. We have changed the way we deliver care. Remember, I'm in the office at 1/10 the price that it was. Bernie Sanders gets that stent. He's in the hospital for a day. He's home recovering. He's not in an ICU with his chest tracked with a fleet of nurses working 3 shifts. Remember that. We are not funding that 1960s health plan anymore. We are funding the social determinants. We are giving more of the patient is involved in their care. The site neutrality is under massive fight. The physician-led hospitals is at war with the hospital association. I think the physician-led hospitals are going to win, and I'm going to tell you why. And the hospitals are stupid to fight this. So site neutrality means that if I take a Blue Cross patient to a Surgery Center, it's going to cost the patient less and the employer less. But if I take that same patient to the hospital, they're going to pay more. That's why I operate in my office on Blue Cross patients. I can do little phlebectomies, but my Medicaid patient, I got to do in the hospital. Okay, because it's, it's so kind of a jobs program, right? We get it. But the problem is a lot of people don't understand that when you have a high-risk patient that's a Blue Cross patient, they need to be done in a hospital. You need those services. You need those ancillary. And you have a low-risk Medicaid patient, you want them in the surgery center. So site neutrality actually will keep hospitals alive, because right now hospitals don't function because the orthopedics have left the building, right? So now you have an OR that's not staffed because all the OR staffing is based on volume and pie charts. So now you have ORs, you can only run 3 rooms. You used to run 5 rooms because the orthopedics were there. They're not there anymore. All that elective surgery is gone, and with it, the staff. So this is a real problem issue. And surgery centers cannot handle sick patients, right? You were going to put that Blue Cross patient to do that knee replacement. I'm going to do it in the surgery center. Not a good idea. They could stay there late at night and then transfer to emergency rooms, and their cost of care then just explodes. So this site neutrality is so important. But I think it's going to get solved at the congressional level soon, which will be really good. And then we can just stop this nonsense and really talk about value. What is value-based care? It means good care, transparent cost, high quality, right? Just let us do our job in the places that we're supposed to do it. So when I think about UBERDOC, I think about optimizing existing capacity. You've got all these walk-ins out there. It's like, oh my gosh, you got specialists too, right? You could cross the street from the urgent care right into the ophthalmology office, right? Wouldn't that be great? And get that thing out of your eye, because that's what it is. And right now you can't do that. You can't get into an eye doctor, right? Forget it. It's like 6 months to a year. You can't get into that dermatologist, but with UBERDOC, you can. So this is how we got validated, because we really lower the cost on that urgent care. So we're direct to consumer healthcare. We're a marketplace, doctors, patients at its very simplest, at its core, doctor, patient. We're compliant with price transparency. We use technology to make this easy. We use technology on all sides. And every qualified doctor doesn't even have to pay anything to join our platform, which makes it even more attractive because we just collect a transaction. We're just the transactor. We do not set the price. We set the transparency. And that gives us opportunities to expand into other services. We're going to launch mammography, which is close to my heart. Book your mammogram with UBERDOC. Happy birthday, you're 40. Insurance isn't going to pay for that, but for $250, you give it to your mother for Mother's Day, you give it to your sister, and that is the gift of life, right? Gift of life. Low dose CAT scan for lung cancer, huge, right? $250, you can get a CAT scan that could save your life. If you wait till Medicare pays for it, you'll be dead. The moonshot is out there. There's all sorts of stuff going for cancer screening. There's all sorts of amazing medicine happening. I won't even touch on behavioral health, because you're right, behavioral health is at the core of this. We are now facilitating appointments from the Department of Massachusetts for their disabled and for their mental health issues, because they came to us and said, wow, this is really easy. Government employee, this is so easy. I can get an appointment really quickly. And we just started that program this month to facilitate about 20,000 of their appointments and up to 60,000 of their appointments. We're incredibly excited about that. So anyway, so that's who we are. I like to say the new face of old-fashioned medicine, because we're doctor patient. It's bring a bag of grain and pay your doctor. Right? Total transparency, no middlemen, and that's who we are. So I will stop sharing my screen, and that's it.
Paula, thank you. Paula, thank you so much. We only have a couple minutes, but I want to give people a chance to answer.
Oh, I'm sorry. I chatted too much.
Hopefully, if you've got the time, we can stay on longer.
I do have time, a little more time. I'm fine.
I want to make sure people have a chance to ask questions, and
yes.
You can respond to those. So anybody that has a question, go ahead.
I've got a question. Steve here. Thanks for your presentation, Doctor. Appreciate it. When it comes to quality on that value matrix, that quality, you mentioned board certification and I think one other term. Are there other metrics that you consider?
We hand select. We're not ZocDoc. You can't get on our platform. We credential. We look for a number of sources, and we also piggyback on their hospital credentials. The hospital credentialing is pretty steep. So we always make sure we have 2 sources to verify.
Okay.
Now, we also request that doctors have to practice the specialty they're boarded in. We sometimes get some people out there that want to do like, oh, I want to do dermatology and gynecology and all this. And it's like, no, our gynecologist on our platform is a board certified gynecologist. And why is that important? Because it's important. There's a lot of people out there who check the box for everything, and we kind of have to uncheck their boxes all the time. And then after a while, we don't, because especially with like the telemedicine side of it, again, we're in person and telemedicine, but we're not like a telemedicine doctors. We're actual practicing physicians who do telemedicine as opposed to telemedicine doctors. Does that make sense?
You accomplished that person's answering my question. So
Um,
thank you very much for that answer. Appreciate it.
yeah.
Anybody else have any questions?
I'll get off the call here now.
I've got a question about mental health. Do you do psychiatry or
Oh,
even
yeah.
child psychiatry?
Psychiatry, we have adolescent psychiatry and psychology with PsyD and PhD.
That's awesome.
And we haven't put any of the licensed social workers on yet. We've been talking about that because of the demand, and through our state program, we are doing that. So we're going to pilot in Massachusetts if it works, because our price point is like anywhere from 150 to 500. That's the range that we let them. So sometimes, like when we kept that price point where it was, because it was physician, we didn't want to be Sesame, which is $39, right? You have to, we're trying to separate out what we are, because there's plenty of opportunities for you to get cheap care, urgent care, digital front ends, all this stuff. We're not that.
Right.
And so
But
the
you're a
price
great
point-
compliment. Yeah, you're a great compliment.
We're
to-
complement to them, but
Yeah,
exactly. In fact, Utah had this company, oh God, it was called like Mend or something. And they had like this enormous digital front end, because Utah has the highest suicide rate in the country.
Yeah.
Go figure. And so they have very few psychiatrists. So people would come to the site, and it's like, the talk space, they're flooded on the front end, but there's nowhere to navigate them afterwards. So we have channel partners in those services right now, like Bowie Health, for example. That's a symptom checker. People go there, but they have nowhere to go at the end. So we're partnering with a lot of people to be that back end. But behavioral health is a tough one. What I'm excited about is family practitioners now are training in psychiatry as well. Family practitioners are doing sports medicine. I train family practitioners, so I have a soft spot. And I'm trying to train them to do wound care, vascular, ambulatory vascular stuff, because there's not enough specialists out there. So they have a primary care physician trained who also has an expertise in psychiatry or elderly medicine or sports medicine, and they're hitting it out of the park.
Nice.
These guys are really good, because they look at the patient holistically. They can understand all those medications and say, wow, how to manage that. And they also know how to refer. But to get those people in private practice in these, I think they're going to be the future, and I actually think they're going to lead the DPC world.
Nice.
You know.
Other questions? Anybody else? Martin, Ray, Vidar, anybody's got a question for Paula before we close things up?
Paula, just send us the deck. That was a good deck.
Excellent.
Oh, okay. Oh, thank you. Yeah, that was.
Yeah, if you want to send that to me, I can. What I will do,
yeah.
I'll send the recording out to our next for our next meeting with everybody, and that way people that couldn't participate can watch this. But if you want to send me the deck, I'll send the deck as well.
Yeah, absolutely, Daryl. It's not proprietary. There's nothing on it that gives away the farm. In fact, that's one of the funny things is, as you know, and Ray can appreciate this, right? When you pitch people to invest in your company, right? And Vidar can appreciate this. They're like, oh, anyone can do this. I'm like, go ahead. Optum can't, and they got way more resources than we do. So that's just a little plug for, understanding who we're dealing with, and physicians train a long time. My residents, and it takes a long time to get to medical school now, right? You have family members who are applying, family, friends, or because your kids are, it takes a long time to get in medical school. Once they're in medical school, then residency starts. Now within residency, within medical school, they're doing research. They take time between they finish their 3rd and 4th year. Then they get into residency and they do more research. So these kids are spending a long time. And why? Because it's very complex, amazing care. I'm going to tell you, medicine has never been better. Medicine has never been better, but medicine is over here. Healthcare is way over here. They're funding healthcare. This is what you want to fund. And that's the way to fund that, is give it to the patient.
Yep.
Give the patients, because all this medicine is happening better, faster, cheaper than it has ever happened before. And trying to go through the golden doors of a hospital to seek care is silly. You know, getting admitted to site. Tell my patients now, when you get a swollen leg, call me, text me. Do not pass go. Do not collect 200. Do not go to the emergency room. They will give you an ultrasound, which you do not need, because I just did one. They will admit you for antibiotics, which you do not need, because you're going to have that red leg. You've had that red leg for 6 years. Okay, and it's just a little swollen, more swollen, and a little redder, because maybe you sat down all day. Maybe you went on a trip. Maybe you just ate too much salt. You know, and it's like to try to get them to not follow that path. And I think that with our younger physicians who are so tech savvy, with the technology we have, we can bypass this silly system and create a few more off ramps and leave the hospitals for people, the resources for the people that need them. Right? We still need hospitals. We still need functioning ORs. We still need ICUs.
Of course.
You know, and we
Just
can't
a lot
eradicate.
fewer of them. Just a
I'm
lot
sorry?
fewer of them.
Excuse me?
Just a lot fewer of them. We don't
right,
need one on
because-
every block.
But right, because at the end of the day, your family is who takes care of you. We send you home with your blood still curdling, you know, drying, and it's your family that has to take care of you, and we do not fund that.
Yep.
Right? All the funding is in that ICU and all that shit that doesn't happen. But you know, I was on a panel recently, or I was at a meeting recently where they had the CVS guy, the CVS, you know, healthcare. I said, you know, 85% of the world, of the citizens of the US live near a CVS. And I've been thinking about this, and Jeff knows I've been thinking about this. And I said, okay, if you went into these communities and you asked voters, would you rather be 30 miles from a hospital or 30 miles from a CVS? What would you choose? And I was thinking about that. Well, I can get everything delivered to me that I could get at CVS, right? Your medication, your shampoo, whatever, toothpaste. But can they deliver a baby? I think that is the most important thing we have to remember, is our hospitals need to be supported, right? We need to have functioning healthcare and medical care. We can't eradicate disease. It's not going to happen. You know, you can't, no matter what public health people say, we're going to just prevent everything and nothing's going to happen. No, you just live longer and you get more problems, right? You know, when I was a vascular trainee, everyone smoked. And we did beautiful jobs, distal bypasses, fempops, legs stayed on, 100% limb salvage, because everyone was dead in 2.5 years. When my patients started to come back to me at 3 years and 4 years and 5 years and 10 years, it's like, oops, I need a better warranty, right? I got to think, just like cancer care, you can't start with the bad stuff first, right? You get a patient with metastatic disease, what do they give you? A pill. When you fail that pill, you get maybe another pill. When you fail that pill, you get chemotherapy. When you fail the chemotherapy, you get something else, right? It's a kick the can. Has that life expectancy? But as that's the way we do it now, right? We just understand that we have to think much less myopic, right? Less myopic. That will inherently increase costs, absolutely. But it also will decrease costs because the site of service will change. So it's that long-term care pill that you're taking at home for 30 years, as opposed to that acute care episode in a very expensive ICU that might just, you need to worry about in the short term. So ultimately it'll balance out, but I think that recognizing where healthcare is going is why we build this new system. And you guys are part of that, because you got to go tell your employers, like, don't worry about it. We don't worry about that anymore. We got you covered.
Well, you've certainly filled a needed niche. Thank you.
Well, like I said, we have, I was a little bit selfish. I'm a surgeon. I like to cut. We like to find our patients nearby.
Well, Paula, thanks so very much.
Thank you, Daryl.
So Paula, I want to talk to you later about trying to make arrangements to have either yourself or somebody at VDAR's thing that's
In
coming up the
Alaska?
night. No,
The
the
one
thing
in
that's in
Washington, DC.
in DC from the 19th to the 22nd. I think he's going to have a lot of super folks there, and I think I'm certainly going to do my best to try to be there. So maybe you can try to
I'll
have
take a look.
presence
That's
there,
like
too.
very good. I was just in DC and it was, sometimes I've gone back for this event. I've done it now the 3 times and I flew there and back on the same day. This time I went the day before because I was always late to the breakfast and the breakfast was the most fun. Because that's where you see everybody, Senator Marshall, Congressman Burgess, the Guthrie, it's super energized, the breakfast. Miller Meeks, this ophthalmologist from Iowa, she won her seat by 5 votes. So they call her landslide.
5 votes. Wow.
Smartest woman you're ever going to meet. Served in the Navy. She's had a fabulous career as an ophthalmologist, and now she's friggin' in Washington changing it. Like, so I have to say these are tough birds. These are really smart people. So I was happy to be there. But then when I flew back because of my flight got delayed by like 2-3 hours and it's just a short flight from Boston because of all the smoke,
Oh, right.
Yeah.
So, but anyways, yeah, DC is an interesting town. Everyone's super happy. I'm just gonna say it's a high energy town. Politicians are always happy.
All right. Well, with that, we're going to sign off. Thank you again for everyone participating today. Thank you, Paula. And we will see everybody in a couple weeks.
Take care.
All right.
Take care.
All right. Thanks.
Bye.
You.
Thank you.